Hello, Dr. Eric here. Ever wonder why you get tingling in your wrist or hands? A condition known as carpal tunnel syndrome is caused when there's pressure applied to the median nerve as it passes through the wrist. Occupations or hobbies like playing an instrument, especially for hours at a time for several days in a row, create fast repetitive movements of the fingers that can cause the tendon, which there's 9 of them that travel through the carpal tunnel, to rub together, creating friction. This leads to heat and eventually swelling and inflammation, which manifests as pain, numbness, tingling. Without treatment or modification to the practice schedule, it is likely that the numbness or tingling in your hands or fingers will gradually worsen and may even completely prohibit you from playing your instrument or your workload. You must accept that every tissue in your body has a certain capacity or threshold, and if it is exceeded, problems will surface. And there are factors that can make some of us more susceptible to carpal tunnel syndrome. Some of these differences include female gender, age over 50, hormonal imbalances like low thyroid function or diabetes, birth control pills, pregnancy, obesity, manually intensive jobs. Personality can even play a role if someone will push themselves through the pain. Then the risk for carpal tunnel syndrome becomes even greater. Because both hands are typically required to play an instrument or type on a keyboard, it's more common that both hands may eventually become symptomatic if you don't practice some very simple preventative tricks of the trade. So what are those tricks? Take 30 to 60 second breaks between sessions or typing. Stretch. Simply bend the wrist and fingers back as far as you can with your other hand, and what will happen is you'll get a stretch of the tendons and the nerves of the hand and wrist. You can do this 5 to 10 seconds as a hold, and you can do it 3 to 4 times a day. Another trick is to wear what's called a cock-up split, which allows your wrist to go into this extension position. When you do this, what happens is the wrist is bent for a position that allows to alleviate pressure or friction on those tendons or nerves. Doctors of chiropractic can also teach you on proper exercises, fish you for a wrist splint, and make sure that the pressure on the median nerve isn't the result of dysfunction in any other anatomical areas along the nerve, such as the neck. If you found this useful information, please share with your friends or family. As always, you can visit our website at any time at fanwoodbackrelief.com. Have an awesome day. Thank you.